Hi. Happy Friday. Okay, so Pamela messaged me that she's just finishing up with a client, so she shall be on shortly. And I know we hinted at this last week, but I think this week it might happen that Margie Haydorn will be joining us, which will be so exciting. I don't expect Margie right as we get started, but I do think at some point during our discussion she may jump on. And that might be a nice, mix to have there. She's, very well-informed therapist. She's one of Carol's authorized instructors. And she actually did all of the research, updated research for the textbook. So just a total wealth of knowledge, knowledge in her hands. She's been a massage therapist for many years, and it will be a joy to have her if we have her pop on today or at another time. At least I'm planting seeds. She will be here at some point. But as those two are thinking about, coming on, I thought I might just go through just a few stats, as we get into the discussion on bed rest and what that means as massage therapists, and what a fulfilling and meaningful way to connect with clients who are having some usually quite stressful pregnancy journeys. So I'm excited to talk about the role that we can play, and share some stories of my experiences working with bed rest clients in their homes, or I've worked with quite a few clients who have been on 24/7 fetal monitoring, like very high risk situations on bed rest. And as difficult as those were some of the most meaningful sessions that I've ever done in my career. And I'm excited to maybe share a little bit about that with you, just so you get, some perspective. I would really like to give you, some logistical pieces of what you might expect walking into a hospital, and also kind of paint the picture emotionally of what might be going on with the mother herself, and also with her family. It's a lot for the family to carry. I just saw Pamela pop on. Hi, Pamela. Let's see. Oh, I think I might need another little minute. Let me see. Oh, there it is. Here she comes. Hi.
Hey.
How are you?
Hello, I'm good. Happy Friday.
Happy Friday. So I already mentioned that perhaps we may see Margie today, which will be exciting. So we'll look out for her if she's able to
Yeah.
join us. And I said, if not this time, I'm sure sometime soon.
Yeah, she's wanting to join us sometime. So,
Yeah. I know it's actually a pretty tiny window to try and jump in. Maybe like 30
That's
minutes.
true. Right.
Yeah. I don't know how it is on your end. I can hear you okay, but the volume actually is like really low for some reason. And my volume is up all the way. I don't know if there's anything you can do about that.
No, not better. Is
Yeah.
it no?
Do I sound okay to you?
Yeah, you sound fine to me. So I changed it a little bit on my end. Does it sound any different?
Not really.
No.
It's okay. I'll just, I can hear you. It's just like much lower than normal.
I don't know what's going on.
Yeah, it's okay. Well, I will just lean into it. Like I said, I can hear you. I just thought I'd ask in case there was anything on your end that you could.
Maybe I'll speak up. Is that better?
Hopefully. I don't know if anyone in the chat can tell us if they can hear you okay. But yeah, I can still hear you.
Okay.
So I was just kind of painting the picture about like this topic that we're gonna get into today, all about, bed rest, and we can kind of talk through like a little bit of statistics. I pulled a few things that I think might be helpful in kind of framing, what it means with bed rest, whether you have partial bed rest or full bed rest, all the way out to like, 24/7 fetal monitoring in the hospital. There's a range of what that can look like. And regardless of where someone is, we as massage therapists have a way to not just interact with that client, but really improve like her physical and mental and emotional comfort. And so,
Yeah.
yeah, I was thinking we should talk about that. And then I thought it might also be helpful to like go through some logistics of like what it's actually like going into a hospital and what you might expect and what you can
Yes.
bring and, you know, professionalism with the staff and what you need to ask, what you need to know, all those things. So
Yeah, those are great. Those are all great points to cover.
awesome.
Yes.
Cool.
Yeah.
And yeah, and I figured we could probably tell some stories
I was
in
just
the
thinking about some
process.
stories in my brain, like, oh yeah, yeah, there's some fun
Yeah, I
stuff.
mean, but we're all wired to learn that way, right? Because
Mhm.
it's like, you know, I
Yeah,
can tell you stats, but if I tell you a story, like you're just
right.
more likely to remember it. So,
Yeah.
yeah,
Yeah.
we're wired, I
Cool.
think, to
Hmm.
learn that way. So, yeah, I was just gonna. Are you okay if I like jump into just like a
Please.
handful of stats that
Yes.
I pulled up?
I would love to, yeah, I would love to hear what they are actually. I'm very
Okay,
curious.
cool. Yeah, so um I think it's important to note that like 1 in 4 pregnancies are going to be labeled high risk in some way, but the majority of those pregnancies are not really going to, they're still going to result in a healthy mom and a healthy baby at the end of the day. And it's only 6 to 8% of those pregnancies that end up requiring very close management and medical care. And those are usually going to be the clients that get put on bed rest.
So can
Um,
I ask you, so 6 to 8% of that 1%, or of that 1 in 4,
yeah, of that one
six
in
to eight
four.
percent of that 1 in 4. Okay,
Yeah.
need close management. Yeah, I mean, it's important to know that because massage therapists get so freaked out about touching pregnant women in general. It's like most of these pregnancies are going to be okay and fine and healthy pregnancies. So,
Absolutely. Yeah. And a high risk, like having one or even several factors of high risk does not mean necessarily that the pregnancy itself is going to have any issues or that the baby is going to have any issues. It just sometimes means that they need a little extra monitoring or there might be some extra
right.
considerations or sometimes it means that they just have more appointments and everything's fine the entire time. So I just thought it might be
Yeah.
helpful to kind of frame that a little bit.
Yes, I think that's important. Hmm.
Yeah. And then I think the other thing to just mention too is that sometimes sometimes the things that tip them into that 6 to 8% where they need some more attention can come up really abruptly and at
Yeah.
any point in the pregnancy.
Yeah.
So you might be seeing someone who has been told up until this point that maybe even their pregnancy is low risk, and then something changes and
Hmm.
they're not just high risk, but they might be like a good candidate for bed rest, you know?
Right.
And usually the reason that, you know, a medical team would be recommending bed rest is to try and stop preterm labor,
Hmm.
right?
Yeah. Yeah.
And so, like, we just so we know that, like, the safest place for a baby, even with all the tech that we have in the world, the safest place for baby usually is going to still be inside mama's womb.
For sure. And that's like to 37 weeks, right? Like they're usually trying to get her to 37 weeks.
Yeah. And that might be different for like twin mamas, you know?
Right. Right. Hmm.
Yeah, which, you know, any multiple gestation is going to be higher risk,
Yeah.
um, much higher likelihood that they might have at least some weeks of their pregnancy on bed rest, right? It
Mhm.
might be like at the very tail end, but it might be much earlier
Yeah. So here's one of those stories. So
on. Okay, yeah.
I have a sister-in-law who had twins, identical twins, and then I have another sister-in-law who had triplets. And that triplet pregnancy, she was on bed rest probably from about 20 weeks on.
Yeah.
She's only barely 5'3", not a very big frame, lots of lots of weight, right, on that uterus.
Oh my gosh, yeah.
Yeah, so yeah, just wanted to jump in with the multiples. Hmm.
Yeah. And I was going to say, especially for a triplet pregnancy, 20 weeks is actually not too bad. I thought you might have even said 12 weeks,
Right.
because that
Yeah.
sometimes can be a
Yeah.
concern very early on.
Hmm.
So,
Yeah.
yeah. Um, yeah. And again, that doesn't necessarily mean that every multiple pregnancy
Mhm.
is going to need that, but it's going to be more likely
Yeah.
in multiple pregnancies, and especially if it's more than two babies.
Hmm.
It's a
Yeah,
lot to ask of the body, of
for
all the
sure.
systems, of the
Yeah.
liver, of the kidneys, of the heart, everything.
Mhm.
Yeah.
Yeah. Hmm.
Yeah.
Yes, lots of extra blood volume and um, yeah,
Yeah.
everything's
And
working
just,
harder.
literally more moving pieces.
Hmm. Yeah, and if you've been pregnant, you know how exhausted you are with one, right? So double that and then triple that, and
Yeah.
that's a lot. Yeah.
Yeah. And I'm thinking 5'3" because I'm 5'2". I couldn't imagine like all of the elbows and all of the
Yeah.
knees and the heads and the just
Yeah.
I just and where are all those organs going? It's yeah. It's
Hmm.
amazing. It's amazing, and yet it's also a lot to ask of the body.
For sure. And then you think about three placentas, right? And three placentas and three,
Yeah.
all this extra weight. Yeah. It's
Yeah.
a lot. Hmm.
You're right. Three extra organs.
Yes.
Yeah, more than likely, unless like two of them are twins that share a placenta. I'm sure that there's some variations of what that can look like that could add to.
Hmm.
But yeah, it's
Yeah.
amazing. Um, yeah, and so, the other thing is that stress can play a huge factor in whether or not bed rest is recommended. And the interesting thing is that stress can cause some of the factors that can result in bed rest, and then bed rest itself can cause more stress, and then it can be this loop, right? And so as we're starting to think about what we can do as massage therapists, there's I think a big and powerful role that we can play in helping to interrupt that cycle for a lot of clients. Oh, you're muted. You're still muted. I can't hear you. Or did I mute you on my end? No. Your little microphone is like crossed out. Tap it and untap it on my side. Yeah, I'm doing that, and it's not doing anything. Worst case scenario, if you can't find it, maybe you could go out and come back in. You want to try that? Okay. The old turn it off and turn it back on trick with tech. I always forget how often that can work. So we'll see. Hopefully, when she pops right back in, maybe her audio will be back to what it normally is, which would be a treat. So we'll give her a second. Yeah, and then we can chat a little bit more about stress on the mom herself, stress on her family too. It really does affect, the entire family, the entire village, and yeah, I really do. I have seen it in my personal practice, and just what a huge difference, compassionate touch can make. It's really, yeah, it's really meaningful work, and you don't even have to necessarily be an expert in everything high risk. You absolutely should have enough information and guidance from any of their care providers to work safely, but um, yeah, it's you aside from like some certain safety factors that we can touch on today. There's so much that can be done with with touch. Let me see if Pamela's waiting on me. Okay, it's adding again. Hey.
Hi, is that better?
um it's not muted. I can hear you. I was hoping it would be as loud as it was like before, but it's not. But it's okay. I can hear you.
That's so strange. Okay, sorry.
No, no worries. And I'm sorry it took a minute too. The request
Okay.
didn't pop up for a second. So,
Yeah.
um, I was thinking that we could just like keep going down the path of stress and
Yeah.
how serious that is, and maybe we could flesh out a little bit of like what stress on the mom feels like, but then also how that affects her larger circle of care.
Yeah.
You know, it can feel very
Mhm.
helpless, I think, for a lot of partners and a lot of family members who can't really do much, you
Right.
know, and
Yeah.
they want to help and they want to fix things. So
Mhm.
yeah. I could tell a story here too.
Okay, good.
Um, and yeah, and then maybe we could chat a little bit about hospital logistics, but I just remember doing a house call for a mom of multiples in the hospital on 24/7 bed rest, and it was her husband that had called to set up the appointment, you know, for me to come. And then, you know, and the first question is like, do you even do house calls, you know, in the hospital? And I'm like, of course, you know, we can
Mhm.
make that work. Um, and so I just wanted to like paint the picture of like when I walked into her room, you know, she was there. And then right across from her, there was this calendar on the wall with a date circled of when it would be safe for her babies to come into the world. And every day leading up to that date was just crossed off, right? And
Yeah.
so just thinking about like her literally counting down the days, sometimes like they're counting down the hours of just making it to this date where they know that their babies are going to be okay and they can sort of exhale, and it can be very difficult for them to exhale before that, you know.
Mm.
um and mentally that's a lot of weight to carry too, right? Because it's like it's almost like mothers can be willing to set aside like their basic comforts and like let alone consider self-care when they're just so focused on I just need my babies to
Yeah,
survive and be safe, which is so valid, you know?
for sure. Mhm.
Yeah, and I just remember like I went in there and you know, we can talk a little bit about like hospital logistics in a second, but I did my work and she just loved it. And you know, and her husband like
Mhm.
walked me out into the hallway and he was like in tears. He was just like, "Thank you
Oh,
so much," you know?
yeah.
Because he didn't know what else to do. And it's, you know, they're seeing a lot of the same faces and a lot of the same nurses. And, you know, the sitting in that unknown is
Mhm.
exhausting. It's so tiring. And there's only so much reassurance that the medical staff can give them or that is even ethical to give them, right? They can't promise
Right,
them a
of
happy
course.
ending, right? Yeah.
Mhm.
She
Yeah,
did have a happy ending, by the way, but
that's good.
yeah,
Yeah, but you're right. Like having a different face and a fresh perspective on you bring something very different than the medical staff can offer. They're there to just make sure medically everything is okay, but they're not giving her compassionate touch, right? Or doing anything for her mental health, really.
yeah,
It's probably the opposite. So, yeah, going into that setting can make such a huge difference. And for the dad, too, right? Like, it's kind of the same in birth. Like, the person you love the most is in so much pain and you don't know what to do for them
yeah,
sometimes, right? You can only offer so many things. So, um, yeah, that's a gift for sure.
yeah, yeah. Do you want to chat a little bit about like hospital logistics?
Yeah, so it's been a very long time since I've done a bed rest patient client in the hospital. Um, it tends to be more someone at home, and I have only had a handful that have been on full 24/7 bed rest. Most of the time, what I've seen is they're on bed rest, they can't leave the house, or they're on modified bed rest, right? That's modified bed rest. They can't leave the house, but they can get up and like go to the bathroom and like, they can be up maybe for a certain amount of hours per day.
Yeah,
Um, and so there is a whole spectrum in there of like how much what the doctors will tell them on how much they can physically do.
yeah,
Um, so hospital logistics, gosh, I think you have to be mentally and spiritually ready to go into the hospital
yeah, yeah,
because you never know what you're going to encounter, right? And
yeah,
you might get there and they might be doing something to your client where you get there and you have to come back in a half an hour or um I don't know, there's just, there might be things going on that you have to navigate.
yeah,
Um And then you have to work with the equipment you have, right? This client is not getting out of the bed to get on a massage table.
No, and I wanted to make that like really, you're not allowed to bring massage tables into
No.
the hospital. And which I was also gonna say, at least in like, I'm imagining in most hospitals, but like LA hospitals, like where you have to park, how far you have to walk. Like, I'm so glad I don't have to also drag a massage table with me.
Oh,
I do
yeah.
bring the side lying system though,
Yeah.
and just put it in
Yes.
her bed.
Yes, that's
Yeah,
the perfect thing to bring with you, for of
yeah,
course. And wedges and bolsters, and then there's, going to be some pillows there. But yes, your side lying system is essential. A couple of maybe like a round bolster or a flat bolster, some other bolster with you would be really nice, or a wedge would be really helpful.
so nice. And I was gonna say, even when they have pillows, they are like the limpest,
I know. They're
weakest,
like
just
twin.
collapsible,
Yes.
like
Yes.
practically useless pillows. Yeah,
Yeah. Yeah. You might be able to fold it in half and put it in a pillowcase and do something with it. But
yeah,
yeah, so you have to figure out how to work with them in bed. And that bed is, it does multiple things, but you have to kind of just navigate the bed situation.
yeah,
It's really, again, we talked about this last week, but it's for the therapist who can go with the flow, I think, and you're not real uptight on the exactly how it looks, because
yeah.
you really have to just make it work. And you want her to feel at ease about you making it work. So if you're stressed, then that's not great. So
That's true. Yeah, it's a really good point.
yeah. Um, and people are going to be coming in and out of the room while you're there. Most likely, you're not going to get this perfect, most likely, you're not going to get a perfect, quiet atmosphere, but you might if she's been there, and, you might be able to dim the lights and pull the curtain and
Yeah, I
do
mean, I've been
aromatherapy.
lucky enough to have most of them. And again, I'm particularly thinking about like the clients who have been on 24/7 bed
Yeah.
rest. I think the nurses were sort of like relieved to just be like,
Uh-huh.
we don't have to
Somebody
deal
else.
with this one
Yeah.
for an hour here. And next time we see her, she's probably going to feel a lot better, you know?
Yeah.
Because it's, yeah,
I mean, if that's something I mean, I'm thinking marketing wise too. If this is something you'd like to do and you get the opportunity to go in, you're right, those nurses will be probably your best advocate, and like, you know,
we make their
they'd
job
probably,
easier.
for sure, and they'd
Yeah,
probably be happy to keep your card around, and, yeah.
yeah, yeah.
Yeah.
Um, And I always, I'm usually going in scrubs just to also look professional. I don't think that that's like, I don't think that you have to do that, but I think like looking professional in
Mhm.
some capacity is important. I think it's always it's necessary to like introduce yourself to whoever their nurse is, or whoever's like the head nurse on charge in case her nurse is on, I don't know, doing something.
Yeah.
um, and just make sure that you ask if there are any restrictions for massage or guidelines that you can give, and they really appreciate that. You not just like, yeah,
Yeah, I think that's so important, right? Looking professional. If you have a name badge you can wear, that's really a nice thing,
yeah,
introducing yourself. And then, yeah, it makes me think about going into like the logistics of the body work itself, right? So we really need to talk about like this person's, if she's on bed rest, especially 24/7, the likelihood of her having clots or a potential for clots is much higher.
yep,
So, we're not going to do any deep, pointy, jostling petrissage of the legs, right? We're going to be doing some range of motion, maybe some joint motility stuff.
which is so
Um,
helpful when they
so
can't move.
helpful. Flexing the foot a little bit, right? You can massage her feet.
Yeah,
Yeah. hmm Yeah.
yeah, yeah, and so I think most of us in this group know that there's already exists a slightly higher increased chance of having blood clots just for being pregnant, period, right?
Yeah.
And that's why even in low risk healthy pregnancies, we don't do anything more than superficial touch on the medial leg.
Mhm.
And so these clients are going to have an increase on top of that increase, and
Yeah.
sometimes substantially so, right? If we have
Mhm.
because twin pregnancies are going to have a higher
Right.
increase, then you add the bed rest, within the pregnancy. So you kind of have to see like how many of these factors for clots exist in this one person at this one time. So yeah, like it would need to be very superficial work in the legs. There are still going to be places where you can do deeper work, where you can
Hmm.
do like myofascial release, where you can do trigger point work. And those are mostly going to be like in her upper body, in her shoulders, along her spine, in her back, which is going to be so appreciated because she's also holding herself up in a lot of semi-reclined positions all day, all night. So,
Yeah.
yeah.
Yeah, and just having the extra circulation and movement of the tissue while she's laying in bed for so long, so important. Yeah.
Yeah.
And
And
the
I
quality
haven't
of the
seen this
skin.
happen. Sorry, go ahead. Sometimes I
Oh,
can't hear you, so I don't mean to talk over you.
no, I just mean the quality of the skin, right? Just again, like, hydration for the tissue and the
Yeah,
skin itself, right? So yeah. Mhm.
100%. Yeah. And again, like the extra weight sitting in the same spots, right? Um, yeah, sorry, I had like two competing thoughts. I was also gonna say that when you are talking to either the doctor or the nurses about any parameters for massage, I always ask, do we need to restrict her to left side lying or not?
Mhm.
And for the majority of the time that I've done it, the answer is always no, which is sort of a relief,
Yeah,
right? So even in some of these like very high risk situations, 24/7 monitoring, I was able to turn the client on both sides, which can be so great because if she's favoring that left side,
yeah,
that can cause a lot of structural issues, right? And so being able to kind of even her out and maybe even spend, more time on one side than the other to kind of help her feel more balanced is huge.
for sure.
Yeah.
Yeah, and that's a good point about even in that situation, most clients won't be restricted to just left sideline, right? So yeah.
Yeah. And
I,
then, and then you have the low risk clients that can come into the office and they're like, I heard I should only be laying on my
yes,
left side. And I'm like, please,
right,
please only do that if your doctor has instructed you that you can only lay on your left side. And sometimes I will even say, like, just as a reference point, like I've worked with these very, very high risk clients, and even they are usually not restricted to only left side lying. And to just kind of paint the picture of like you can cause other imbalances, which can affect,
hmm,
ligaments and where your womb itself is sitting and where baby can be positioned, and it's uncomfortable. It can cause you pain and discomfort throughout your pregnancy. It's not recommended.
right, hmm,
Yeah.
absolutely, yeah.
Um, yeah. So I
What
think
about?
another key point is to focus on nervous system strokes, right? Since
Mhm.
stress is such a key factor here.
Yeah,
And to maybe even teach partners like for
mm,
example, like 311 is usually pretty accessible. I'm thinking especially like in the hospital if she's in a gown with like an open back, and just can be so easy to do that series. And then you're giving her the care, but you're also empowering the partner with something that's usually simple
mhm.
enough for them to do and to do well enough. And then like you're bringing a couple closer in the process, which is
Yeah.
it's a gift.
Yeah. Yeah. I think anything you can teach the partner where they can, again, connect. I mean, because the reality is if she's there 24/7, that partner's not there 24/7. They're spending a lot of time apart. If there's other children at home, there's a lot of extra stress. That partner's taking care of the kids. That usually gets put onto like grandparents or neighbors or friends or,
Yeah.
so like you said, those outside, it compounds beyond just this person being on bed rest, right? So,
Yeah, yeah. And
yeah.
that makes me think of like another mom that I worked with, also on 24/7 bed rest, also with multiples, but had other kids at home. And
Yeah.
and she was real frustrated. She's like, I want to get the hell out of here. That
Right.
was her attitude. She was not nearly as like scared or as stressed, but she was frustrated and she did not want to be there, and she was not always certain if things were as precarious as the
Uh,
medical team thought. Um, yeah. So you're
Yeah.
gonna walk into different scenarios, and she wanted to be home with her family, and it
Yeah.
was very hard on her. So it was a different kind of mental hardness.
Right.
But yeah.
Yeah, that's stressful for sure. And then just that level of stress, you think about what's happening in the body with the cortisol and that, keeping her nervous system highly elevated. And, we want this baby to get as much blood and circulation as possible. But when she's in that really high stress situation, it's not ideal. We know that that does cause preterm all by itself,
Yeah.
right? So,
Yeah.
yeah,
Yeah, and just like where does blood flow when we're in that sympathetic fight or flight state? It's going to go away from the center of
right.
the body. So yeah, we can kind of redirect that if we can change her nervous system state. Yeah. Yeah,
Yeah,
beautifully said. Um and then yeah, maybe we could just like flush out a little bit more of just like you already touched on like the range of types of bed rest. So it
mm,
can range anywhere from like what we were talking about, this 24/7, in the hospital, that's probably as extreme as it's going to get, to you need to take your maternity leave way earlier than you thought and get out of your crazy high stress job, and
yeah,
you can. So I've had bed rest clients that were allowed like a certain number of hours out,
yeah,
and coming to my office was where they wanted to spend those hours, and that was also really sweet because it can be, you can feel sort of like you're on house arrest, right? Just
yeah,
mentally, it's like the same walls, the same room. And I think especially for women who, um, have these high stress jobs and they're being asked to like sit still,
right.
essentially, right? And to slow down. It's like, how do we, she has no concept of what that even feels like in her body, and it can feel almost torturous, right?
Yeah. And it can happen overnight, like you said. Like she
Yeah.
could have been fine, and then all of a sudden now she's like has to sit inside all day, and so she's yeah losing, not very comfortable in her body or in her mental state because she's really doesn't want to just be stuck inside. And they'll push the boundaries. I've seen mamas on bed rest push the boundaries of how much they're doing because they just can't seem to sit still because they don't know how, right?
Yeah.
Yeah, we don't live in a world, and our culture doesn't really appreciate stillness or
Yeah.
being in one space, and so that's hard on them.
Yeah, and that's another like very practical application of our work. Is not just to help her feel better, but also how to like literally help her nervous system downshift so that it kind of has like a map of like, this is what it feels like. This is what you can get back to. This is your breath. This
Mhm.
is okay. This is an okay place for you to go to.
Yeah,
And we're
and
there with her as she's finding her way to that place.
yeah, I love that because it is true. We can, give her a map if she doesn't have any clue what it looks like to be home for weeks and weeks
Yeah.
and doesn't know what to do with herself. You can guide her in some breath work or, some gentle movement or, give her suggestions for some activities or just some things that might be helpful.
Yeah, and actually that I think that you just kind of made me think of a point that I had forgotten back there. I haven't seen this happen as much as I feel like it should happen, but some clients are going to have some PT or some like
Um,
exercises that they can be doing at home. And as
mhm.
massage therapists, I think it can also be helpful to ask them what that regimen looks like and if anything is difficult for them to do or painful for them to do, because it could be that can be something that you can tie into your session to get a little bit of the myofascial
Yeah,
space in order for her to better achieve those exercises that she's been given. So you can kind of tie their goals together with your skills. Yeah.
yeah, that's perfect. Yeah,
Yeah.
nice.
Oh my gosh, it's 1:35. It went by so fast.
No, yeah,
I did have one more thought, just to like kind of plant this seed as a safety consideration as well. I'm just thinking about abdominal work with anyone
thank you.
on bed
Yeah,
rest, right? Because a lot of the structures that might be problematic, like in terms of fearing preterm labor, are housed within the abdomen, right?
yeah.
And so sometimes, like even if you're just doing superficial touch,
Mhm.
and you know that you're not doing anything so deep to
I
activate anything, there's still that perception and there's still that liability risk that I think that as therapists you have to really consider if that's even an
Mhm.
area that is worth working on. And I personally would say no. I don't know
I,
about you.
yeah, I would not do any abdominal massage with a client on bed rest.
Yeah.
Yeah.
Yeah. Cool.
Yeah.
I
Just
think,
you just want to avoid it.
yeah, I agree. And like I said, there's lots of other areas that are going to likely be more stressed and more strained that are going to feel so good and are much safer
Yeah.
for us to be touching and working on. So,
Yeah.
yes, I hope this talk was helpful. It sure did go by fast though, didn't it today?
Yeah. It did go by really fast. I think it was a great conversation, lots of great points, such an important conversation, I think, because
Yeah,
those mamas need the work so bad. So,
they
yeah.
do.
Yeah.
Yeah, they do. And I would love to, yeah, encourage therapists who haven't done it yet to, um, you know, if you're open to it, if it comes across your plate, do it. But perhaps also just put it out to the community that,
Yeah.
you're available to all mothers and all, different variations of what pregnancy can look like.
Yeah.
Yeah,
Yeah.
awesome.
All right. Well, happy Friday. Hope you have a
Happy
great weekend.
Friday. Thank you. You too. See you next week.
Yeah. Okay,
Bye,
bye.
everybody.